Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. A lot of breaking news this morning. Let's start with the first, an effort by the leadership of the state Senate to kill off the expansion of charter schools. As one example, Achievement First, one of the biggest charter schools in the state of Rhode Island, if it was its own school district, would be the best performing school district in the state. Better than Barrington or East Greenwich or any other affluent community. But the state Senate does not want to see that expand. Read about it. There's also a subsequent editorial as well. Take a look at those two pieces. The big news nationally is, or one of the big pieces of news nationally is that the South African variant of COVID has now been detected in the United States and South Carolina. Let's go to Dr. Michael Fine and have a discussion about how these variants are affecting our response to the virus. Dr. Fine, thank you so much for joining us.
Always good to be with you, Josh.
Okay, we know the UK is here. It's having a very significant impact, as an example, in the state of Michigan, where they've locked down the University of Michigan because of the extreme exposure and spread of the virus. Now we know that the variant from South Africa that has other concerns is now in place. I'm sure it's in other places, as we all know. What's the impact of, let's talk about the South African variant now?
Well, the impact of all these variants is that they appear to be more transmissible, which means they will infect more people faster. It also means that the level of disease we have at our degree of masking and contact tracing won't be enough. So unless we change our behaviors, we're going to see rapid spread, and rapid spread has its own dangers. The dangers are the dangers of overtaxing the healthcare system to the extent there is one, the hospitals, and having deaths that are caused by people's inability to get the care they need. That's the danger.
Dr. Fine, I've heard some health experts, both UK and even Dr. Fauci, talk about what the implications are from a day-to-day life, whether or not many are now urging to double mask, wear a traditional cloth mask under another mask. They also talk about the dangers of eating in a restaurant. Just the simple fact of taking off your mask in an environment, closed environment, may increase the spread. This is a significant change, and it requires a significant change, correct?
Yeah, I mean, just at the moment when people are really tired of this, we have to go back and say, not only do you need to keep masking, whether you're immunized or not, but you need to mask more intensely. You know, in Central Falls, I spent a long time trying to get people to mask in their houses. I think we're probably going to need to do that if people are in contact with the rest of the world and have family members at home. So masking at home, it means doubling down on social distancing. I think it will mean more heartache for bars and restaurants, because I don't see how they're going to be able to function. You know, we're tired. We don't want to do this anymore. And these variants are going to say, not only do you have to do it more, you have to continue to do it, but you have to do it more intensely.
Dr. Fine, this morning, a member of the Biden task force on COVID response, the professor from the University of Minnesota, was on, painting a very dire picture, as dire a picture that we've ever heard over the past year, saying that the next 12 to 16 months will be the most ominous that we have seen. Significantly wider spread, significantly higher rate of infection. And he tracked it to these different variants, now that we have the UK, the South African, and the Brazilian. Is that the right prognosis? Is that what we're facing?
Well, you know, I think that assumes that we have our level of national discord and our disagreement about everything, about things like masking and social distancing. If we're going to fight about every little thing and not want to do what our public health experts tell us to do, then we're going to have an awful time. And my guess is that awful time is going to start about March. Remember, we're at a high level of disease now. It's not like we're starting from no disease. We've got widespread disease all across the United States, and particularly in Rhode Island. If that doubles or triples, you can imagine the life that we're going to have. And my guess is when you work the numbers in terms of doubling times and so forth, that starts at the end of February or beginning of March.
Massachusetts has relaxed some restrictions and expanded hours in which restaurants can operate. Town councils in Rhode Island are urging Governor Raimondo McKee, absent Raimondo, incoming McKee, to relax certain hours of operations as well as the use of bar spaces, et cetera, to kind of a little bit of a return to normalcy. If Lieutenant Governor McKee called you this afternoon and asked for your recommendation, knowing the pressure of what Governor Baker's recently decided, what's your thoughts on the relaxation of some of these business restrictions that are ongoing now?
I think all those restrictions can be relaxed the moment we get to less than 2 new cases per 100,000 per day. And I think we should all work toward that, focus on that number, and not let down our guard until we get there.
But Dr. Fine, we're at 600 and 700, not 2.
I know, we've got a long way to go, but that's what the science tells me. And I don't want to, pretty it up because it's politically more acceptable. The science says, buckle down, do what you need to do, and save lives. If you want to save lives. You don't want to save lives? Have a party.
Super Bowl's right around the corner. Let's talk about this. This White House, the Biden White House, is far more transparent, and I think appears to be appropriately setting expectations that the vaccination of the U.S. population is going to take at least until the end of the summer, and that it may take, in fact, longer. In Rhode Island, we should have the competitive advantage, right? We've gotten according to the CDC, we have 151,000 doses delivered to us. According to the CDC, we've used less than half of it. According to the Department of Health numbers, we've used slightly more than half of that number, just barely more than 50% of it. But regardless, at some point, we're going to start getting more. I believe next week we get 10 or 15% more vaccine on a weekly basis. And at some point after that, we'll get a lot more vaccine on a weekly basis. Do we have an infrastructure to effectively now begin to vaccinate Rhode Island's population?
Well, I think we have it on paper. Now we need to see it in the real world. We need to tune it up and make it run. Like I said, like I keep saying, I'd love to see us testing with a couple of hundred doses in every community so we get the opportunity to work out the kinks. There's some complicated pieces of this. Finding the people who need to be vaccinated, getting them vaccinated, making sure that they're enrolled for a second shot, and making sure they get a second shot. So, there are a lot of moving parts. It's pretty complicated. And I think, the sooner we get the whole distribution system out there, the better I'll like it. I actually saw a report today that really supports the idea of having primary care physicians do this. I haven't seen us move in that direction, but I would love to see us go there because it's primary care physicians who are best poised to be the trusted messenger and make sure all their patients get vaccinated, and it's their patients who are likely to be the people who are most at risk.
Data out of Israel shows that, in fact, the 90% or even 94% effective rate of the Pfizer and Moderna vaccines may actually, in fact, be low, that they're finding through independent analysis of those who have received both vaccination shots that they're more effective than that. That's probably one of the better pieces of news that we've heard yet to date.
Well, that makes them, among the most effective vaccines we've ever seen. Most vaccines aren't that good, but boy, is it nice to know that that's the case. The question is, will they be the same? Will we have the same level of effectiveness against new variants? I'm beginning to think that we're going to be in a time of kind of constant vaccination. that as new variants emerge, we're going to develop tune-ups or changes or additions to the vaccine, and we're going to have to add to them as we go. That people may need to get vaccinated, not just twice, but maybe once or twice a year until we put this thing behind us, which I think will be 3 to 5 years away.
And just think about it. Maybe we'll be good by the fourth shot. People will actually know when to get a vaccination. There will be a supply. We'll know where to go, who to contact, where to sign up online, all those sort of basic things that could have been developed over the past, certainly 6 months, since we knew where the vaccines were coming from and where they were in the development cycle. It is just mesmerizingly confusing of how states like Rhode Island have been so inept in pre-planning for vaccinations.
Yeah, well, I'd like to think that there's more planning than we're seeing, but regardless, when that whole distribution system is set up, I think I'll be happier, and so will everybody else. And remember, this is where my expectation that we may need kind of a period of continuous vaccination. I think that needs to come into the planning process, because I'm not sure what we're planning to stand up in cities and towns really is going to be sustainable over more than 6 or 8 months.
When I was a small child, the saying was, if we can send a man to the moon, we ought to be able to X, Y, or Z. I mean, heck, the space program invented Tang. If they can invent Tang, they can invent anything. But think about this, in 1947 or 48, New York City vaccinated 5 million people in like 30 days for the measles. I mean, we just seemed caught up in our own ineptitude. We can put apps on everyone's phone. The penetration rate of smartphones is, over 80%, but we can't inform anybody of anything in an efficient way.
Josh, this is where having a healthcare system would matter. I've interestingly begun to hear at the national level a new discussion about providing primary care to all Americans, which would be the healthcare system that could do this. I hope those discussions go forward, because remember, this is the softball. This is a cold virus. This is not the bad one. We actually have to be prepared. This is the message that says get prepared for the bad one, and I hope we hear that message and change.
But Dr. Fine, spammers can find me, right? I've signed up for no spam calls. Spammers still find my phone. The state of Rhode Island can't send me a text or dial me up or send me an email. I get 700 emails a day. The Department of Health can't tell me when I should think about being vaccinated.
The federal government knows everybody over 65 who signed up for Medicare, which is basically everybody. We can't use that, can't find a way to use that data and find at least people over 65. This is crazy.
Yeah,
and this is way beyond what the Department of Health is or isn't doing. This is our sort of abandonment of our responsibility to build a healthcare system that gives us the kind of resilience we need. It's so clear to me that this virus, is the great revealer, has revealed something some of us have been worried about and laid it open for everybody to see, but we still have to see it and act on it.
Dr. Fine, thank you as always. Appreciate you taking the time. Incredibly helpful for Rhode Islanders to hear sort of this fair broker's voice, and appreciate everything you do to keep people informed. For everybody else, stay tuned. It is January in Rhode Island, and there's no shortage of news. GoLocal will have more updates today. Stay tuned for those. And if you haven't, sign up for our e-blast on the homepage in the top right corner and on the mobile device over on the far left side. Today, make an extra effort, stay safe, wear your mask, protect each other. These variants are coming. They're not helpful to the cause. They're going to spread faster, and our best practices are needed now more than ever. Please, everybody, stay safe, wear your mask.
Thanks, Josh.